Welcome to St. Vincent Health System in Little Rock, Arkansas, and thank you for the opportunity today to talk to you a little bit about leadership formation. From an outsider's view, St. Vincent has had up and down performance over the last 10 to 15 years. Probably from your view, more down than up. So over the last 4 years under my leadership, we've tried to change that conversation. And with change, there comes consternation and concern. We've been embarking upon a rebuilding and building campaign. It's a little bit like expanding your house or doubling the size of it and also renovating the entire inside at the same time. It doesn't make for happiness and great relationships inside the house. We've had to deal with labor issues, supply chain, fixing our revenue cycle, which is currently underway, looking at programs and services, so discontinuing our operations in geriatric psychiatry and ophthalmology, and then also shutting down our St. Vincent Doctors campus across the street from our main campus, St. Vincent Infirmary, amongst many other things. Over the last 10 to 15 years, senior leadership has changed, but the constants in the organization have been the medical staff, middle management, and frontline leadership. And that's where we've had some cause for concern as we've embarked upon these changes over the last couple years.
Ever since I've attended the class, I tried to take some of the principles that I learned in leadership formation and put it into my daily work. Just trying to make sure that I connect with the staff better and just trying to see the good in everyone.
Having had the leadership formation and provided that background, that stable base of understanding of why we do this and what is our mission and purpose. Is it just to take care of the patients? It is, but at the same time it is to provide that spiritual background as well. And the nurses, not just the leaders, need to understand that. So it's my job to give that information to my nurses as well and provide that picture to those that don't attend leadership formation.
I am here for the heritage and the legacy. I want to be a part of something that is going to be here in 100 years or 200 years. And knowing that these sisters, when they came here, and they were very young, for them to come here not knowing what they were getting into, they did the best they could. If I'm doing the best I can, then I'm doing what needs to be done for St. Vincent.
CHI provides a great framework for change leadership. So we, over the last 2 years, trained every manager and director in the organization in CAP and workout tools, but still found that that wasn't enough. We didn't have a context for the change. The changes were being perceived as massive and radical and really goring some people's oxes. But if you look at our history over the last 123 years here at St. Vincent, these changes are small in magnitude. If you ask the first sisters from the Sisters of Charity of Nazareth that took 8-hour train ride here from Nazareth, Kentucky, I think our changes would look minimal. So I challenged Derek Paul, our Chief People Officer, and Peter Noonan, our Vice President of Mission, to work with Patrick Gahn and Alan Bowman to model a leadership orientation or a leadership formation session after the work that CHI has already done. I've worked in 2 other national Catholic systems, and CHI by far has the most deliberate and focused way of orienting leaders to Catholic healthcare and what it means to work at CHI. So over a couple months, those 4 individuals worked together to form a leadership formation initiative for St. Vincent that all of our middle managers during fiscal year 11 had the opportunity to participate in.
The leadership formation actually helps play into the business practice and the business decisions that are made. It helps to keep us grounded in our decisions.
We are now an extension of Jesus Christ. And so as we go around, go through the hospital portraying our ministry, we're also carrying out the work of the nuns.
For me, it's a great responsibility to carry the legacy of the nuns forward. And in a ways, it's not just a great responsibility, but a sacred responsibility as well.
I don't believe that people necessarily come here as employees because of St. Vincent's heritage and tradition, but I think people stay with the heritage and tradition. And I believe that leadership formation just reaffirms that commitment for a lot of employees.
There must be something that we're doing right, because when I interview candidates for positions here, they say that when you walk into the hospital, there's a different feeling. When they walk into the department, they know this is where they need to be, they feel blessed, then it tells me that what we're doing is working.
We launched our first leadership formation cohort in November of 2010. Patrick and Alan worked directly on site with Peter and Derek to get it off the ground and work out the kinks. It provides a great opportunity for us to talk to in a community that is not predominantly Catholic, what it means to be a Catholic organization and how that impacts our leadership, our history and heritage, how we manage our relationships, how we manage care. It was really meant to provide a great opportunity for myself and senior leadership to work directly with our middle managers in a small, cozy setting to talk about where we've been and provided a context for where we're going as an organization. So our middle managers spend a day and a half or 2 days together off-site working through this in six different cohorts. And then a month later, Peter, Derek, and I spend a lunch with our middle managers talking about what they've learned and how they've assimilated that into their daily work. This has really provided a great context for our changes that we've done in the past and that we're going to embark upon in the future because, as we all know, healthcare is changing dramatically and change is a part of our daily operation. Thank you for the opportunity today again to talk to you about leadership formation. The work that Patrick and Alan did are having a major impact upon us moving faster, more accurately, producing change, and for everybody involved, producing consistent, predictable performance for St. Vincent Health System in Little Rock for the long term.
Hello, my name is Sean Reynolds. I'm the President and CEO of St. Joseph Health Ministries in Lancaster, Pennsylvania, one of the CHSOs in the CHI system, and I'm pleased to share with you a few thoughts and takeaways that I had from my time attending the Foundations program not long after I started with CHI in my position. The first takeaway I had from the program was the level and depth of the spirituality and the faith that we all experienced in our time in Denver. It wasn't just a side note or a piece of the program, but the message of the Gospels and the faithfulness of the program was really a core strategy that was shown to us to drive everything that CHI does. It wasn't that operating revenue had to be in a good place before spirituality was emphasized. It wasn't that fundraising or program strength had to be 100% before we focused on the message of the gospel. What we learned in the Foundations program was that that was a core strategy to achieve those other goals and those other outcome measures. And for me, coming from outside the organization into CHI, that was a very eye-opening experience, and it was reassuring to know that what I was seeking in an organization I found through the message of that Foundations program. The second takeaway I experienced was a certain vulnerability in the group, which again was surprising, inspiring to me as well. There were a lot of people in the session who had been with CHI a number of years, people in important and prestigious positions in their entities. They might have been senior vice presidents at the national office or CEOs across the CHI system, and yet they were willing to share the vulnerabilities of how they came to their places of leadership, the bumps and the bruises. And what I had often experienced in leadership programs was that people would focus on the positive aspects of their career, the things that they had achieved, the success that they had, and not so much on the difficulties that they had. And so when I speak about vulnerability, it's almost a humility that the people in the group had, and I was very impressed by that. Again, being new to the system, it was something I had not experienced in past leadership programs. And I would say that the last takeaway that I want to share with you about the Foundations program was a feeling of stewardship, a responsibility that I had. I recognized that a lot of my team in Lancaster would not necessarily have the opportunity to experience or participate in the Foundations program, at least not in the near future. And so there was a lot around the message and the theme that I experienced in the Foundations program that I felt a responsibility to bring back to our team and to our operations here in Lancaster. and that if we could take those themes and drive it through what we do each and every day as an entire group, it would help me to be a better leader and a better CEO. And so it was a sense of responsibility that I had and stewardship over the information that I was hearing and experiencing when I was in Denver through the program. So I'm pleased to share those three takeaways with you. I thought the program was extremely well done, and again, for someone who was new to CHI, it allowed me to translate a lot of what I had heard in messages and in the strategic plan into real action when I came back to my organization in my local community. Thank you.
Hi, I'm Cathy Sanford. I'm the Chief Nursing Officer for CHI. Together with my dyad partner, Dr. Steve Moore, our Chief Medical Officer, I have the pleasure of leading the Clinical Services Group for CHI. We work with a group called the Clinical Leadership Council, which is made up of physicians, nurses, and pharmacist leaders who have been selected by their colleagues from across the system to represent them and to meet with us and to figure out all things clinical, make the decisions about where we're going, and look at new models. As we've been working with the CLC, we realized that we all need more leadership formation, and we also knew right where to go to get the help for that. We went to the center and worked with them, and in doing so are working together to come up with all of the leadership skills that we're going to need to make sure that we carry our rich legacy into the future. We started with the CLC on a trip to Dubuque, Iowa, led by Sister Peggy and supported by the center. Alan and Pat came along. We spent time there visiting the Women in Spirit exhibit, and then we spent time talking about what that exhibit meant to all of us, how it showed us that the courage, the convictions, the strength, the faith, and the love of the sisters in the past will mean to us as we go forward. We've worked together with the center on a variety of issues that have to do with clinical services. One of those has to do with selecting a nursing theory. A lot of people don't know that nurses have theories, but if you're on the magnet journey for a hospital, you have to have a nursing theory, and there are a variety of them all over the place. We decided that if we were going to have a nursing theory for Catholic health initiatives, we needed to be sure that that theory supported Catholic social teachings and the ERDs. We wanted to make sure that any theory we came up with would carry forward the legacy. In order to do that, we needed a discernment process to make sure that the mission folks and the center agreed with us that the theories selected would do just that. We were lucky to have Carl Middleton meet with us and to spend time with us and to go through the discernment process, and we're able to select several theories that the individual MBOs can choose from among. One of the issues with Magnet is that the nurses must choose their own theory, so we gave them a series that they could select from. We are pleased to say that we're currently in the process of putting together an article for Healthcare Progress, where we will be able to share this work with the rest of the Catholic healthcare systems. We believe we are the first Catholic system to do this, tying together mission, vision, and nursing theory. CSG and CLC has a great partnership with the center. The bottom line for us is we're working together to transfer the necessary skills that we're going to need for a successful future based on a wonderful, rich past as part of our Catholic healthcare ministry.